Hi Collette. Hi Patricia. What made you pick brain cancer?
I worked in a lab in University College Cork studying neuroscience as my background, and I took great interest in the research of my supervisors, Andre Toulouse and Collette Hand, and they were researching a type of brain tumour called glioblastoma, which is a type of brain tumour, as you know, that affects the support neuron or support cells of the brain called the glia, as opposed to the neurons. It's one of the, for a rare cancer, it's one of the most common brain tumours that can affect adults, with, I think, 250 to 300 people in Ireland every single year being diagnosed with glioblastoma. And because it is considered to be a poor prognosis cancer, it's really deserving of more research and attention. So I chose that project as something I wanted to continue my PhD into as well, to really give it the attention that it deserves.
And the research at the moment, how is it going?
It's going good. So I'm halfway into my PhD with breakthrough cancer research on the Musgrave Scholarship, and I'm working in a cell with cell lines.
What is a cell line that you talk about?
So my research takes place in a lab using cell lines, and they would have originated from a biopsied sample of a tumour that someone would have had tested in hospital. And the cells that they give are what we call immortalised in a dish. They keep growing, and they're available then for researchers to use as an example of a tumour that I can use in a lab to experiment on without harming any people or anyone like that. So I have samples of tumours that I grow as cell lines in dishes in the lab. I can use those to experiment on, and that's what my project is based on. So it's entirely in the lab for now, where I'm trying out new medications and new ways of treating glioblastoma.
It's great because when I was diagnosed, I knew nothing about it, and now I know 4 or 5 people once we started talking in the area.
Yeah.
And for someone to tell you have a rare cancer, and then, like, we're a small area and I know a load of people with it.
Yeah.
You know, so it's so good that there's someone starting to research it, because you were kind of given no hope. Do you know what I mean? And it's so good.
You don't like to hear that there's nothing out there, there's nothing being done, because the project is there that I'm doing is actively working towards finding something, and that's the overall plan, is to get there, so that nobody feels that there's no hope, that they're
and you're
alone in it at all.
You don't get that. You don't get that information out there, that there is people working in the background. It's like you've got this cancer, it's a rare cancer, and you can't be cured. And it's so nice to know that there is work going on here in Ireland.
Only up the road.
Only up the road. That you hear people travelling all over the world, but it's so good to have it here in Ireland. And how soon do you think that your trials will get out to the general public?
So my PhD that I'm exactly halfway through now, so I have a year and a half left of that. Once that project finishes and my in vitro work done, which is the cell line work done, the next step would be to progress it through to clinical trials, which is a very long process, unfortunately, but it has to be to get through a load of safety checks.
Yeah.
So once it finishes in the lab, it usually has to go through several other stages of testing before it can be brought into clinics. So there's several stages of the trial in which the medicine, once it's deemed to be effective in the lab on the cell lines, would have to proceed through testing for toxicity with people who don't have any illness, just to see if it will harm their system. And then it will gradually proceed into more and more stages of groups of people to see, are there any side effects maybe that are unwanted, or how that might be tailored down to provide the best and effective treatment for the people who need it most, which can take 10 or 15 years. And that's why it's always important to get the research started as soon as possible, with as targeted an aim as possible, so that you're not looking into the vast expanse, because that goes against everything we need now. We need effective treatment, and we need it as soon as possible, but with all of those safety checks in place. So I'm midway through my project now, and the hopes would be to get the positive results we need out of it that I can bring, and then progress that forward on into the next stage of people who can take it further, and eventually hope to see it in clinics and with people who need it.
So you're looking at 5+ minimum years down the line.
Yeah, to get it through the safety checks and to make sure that it is effective and does what I want it to do, and what I can start to see it doing in the lab with cells. That needs to translate into people as well, and really make sure that it is doing everything we think.
What can be done to help you?
To help us as researchers?
Yeah.
I suppose there's a few different things. So patients can be involved in informing researchers as to what kind of research needs to be done, what they need from us as researchers. At a very practical level, people can be directly involved. Obviously, funding is a huge area. Raising money to fund research projects, the kind of work that we do, takes a long time and costs a lot of money. So that's why things like breakthrough cancer research is vital. And as Patricia is explaining, we need this to be going on all the time, because it takes such a long time to get to a point of having something that's useful in a clinic. So we need that kind of always to be doing the basic research behind that leads through to clinical research.
So it's streaming, it's kind of streaming stuff through, and hopefully it'll benefit somebody then coming along in the next few years.
Yes, and I suppose we always hope that with people as they progress through their disease, that maybe more medicines come online, even throughout their treatment, that something might be available in a year or two's time that wasn't available before. But to ensure that continuity, we always have to be providing that basic research, and that's what needs to be funded to get the medicines to the clinic.
And it's hard to get funding, I'd say, because there's so many different cancers, and it's not one of the big ones that you hear about. Like, I wouldn't have been aware of the brain cancer until I actually got it myself. It wouldn't have been something that you would have been saying, cancer research, I must give to that now for brain. Do you know what I mean? It's not one of the, the way the breast cancer and all are highlighted, and bowel cancer and stuff, it's not one of the big ones highlighted out there. But there's so many, I seen when I was going to the hospitals, so many children affected by it, and it's not as well known, and I can't understand how it's not as well known out there, because the amount of children and people, when we seen them going through the hospitals, was unreal.
You're right, and it's an awareness thing. As you say, that breast cancer are very good at promoting and making awareness, but other cancer types are maybe not as common, but are common enough, and research is needed. Some research will be applicable across many different cancer types, but some is really targeted to certain types, and we need to research those specifically to help those patients specifically.
The more people know about a certain cancer, they know what to look out for. They can be more aware, and it can be brought to the attention of their GP and to doctors as well. And the more people are aware and raise funds for these cancers, the more money can be put into research and bring, hopefully, the recovery levels to match those of the ones that people know about. And they recognise those cancers and they see the bucket, and people are very good. They're very willing to help with research. Yeah. And if they hear the stories, then they'll be more inclined to. And then we need to put the research into those other cancers as well. And it's great that cancer research has such a strong footing in Ireland, but we need to share those resources and share the attention as well, and the awareness, which is...
Yeah, because I was just wondering, like, there's no reason the doctors can give me for getting brain cancer. Is there anything that you know as researchers, a reason for it?
So that's a really good question, and it's a question I think a lot of people would have, and it's really important to understand that for brain cancer, there's really no risk factor. For other cancers, we're well aware that if you do this, or if you have certain diseases, your risk of a cancer is increased. But for brain cancer, it's really just if you've had treatment before with radiation, that seems to be the big risk factor. So, and that's a really important point, because it can be anybody. We're not aware of any other significant risk factors. So there's no reason that it's you, which means it could be anybody, and you speaking with us today and supporting breakthrough research in their aims to identify treatments or help understand cancers. You're doing a huge role, you're carrying out a huge role in raising awareness and getting people to understand it could be me. And we're really fortunate to be here today in this beautiful setting of the Delta Sensory Gardens in Carlow, to be able to chat with you and understand from your perspective what you need from researchers, or what you'd like us to do or help with.
Yeah, you feel like you're just asking the silly questions like, why me and why not me? And do you know what I mean? But it's just, there's reasons for other cancers, and you just feel like I didn't do anything to my body to make this happen to me. you know, and you just feel a little hard done by because you didn't do anything. My symptoms were I didn't have any symptoms. So I didn't have any of the blackouts, any of the fits, any seizures. So it wasn't clicked as brain cancer. I was kind of diagnosed as maybe stroke until they done the MRI. And then it was obvious, you know, and you do your treatment and you get through your radium and your chemo, but then you're kind of left. It's kind of, there's nowhere to go then after it. And sometimes you feel isolated. People think like that, yes, there needs to be kind of continuous care somewhere. Just even checking in with patients and stuff like.
It's the whole community of cancer research, from patients and their families to researchers in the lab to the medical personnel to the charities to all of the medical support teams around it. It really does take a village, and nobody should go through any of it in isolation. That's why it's great to be able to, I suppose, bring all of that together. And I think Breakthrough does a lot of that, bringing different groups together, because it's a community, and no one should be isolated or feel like they're alone in that regards, because there's so much support goes into minding someone with cancer and their families as well.
Well, you see, you have the little groups. We have 8 here in Carlow, and they're amazing, and they're amazing support, like, you know, and there is the little breakaway groups, but on a whole, you'd be saying that coming out of the hospital, there should be a connection, that you shouldn't be relying on the charities, that there should be some help for ye and all the charities like that. They can continuous care like can come in, and your research, that we be knowing what's coming online and giving you hope.
And as researchers, what can we do to help bridge that gap a little bit? I suppose from somebody who's living that experience and their family, and connecting that to our research, that you know what we're doing, or can ask the questions that you have.
It's just highlighting the fact that we want to know. We're inquisitive. We're saying, what's coming? Is there anything coming online? Do you know, everybody's saying, like, if you could get another year or 2, there'll be something. And everybody's looking for this something, you know. And it's just to let people know that you are working in the background, and that you are working hard, and that you are streaming stuff, and it will take time. Do you know what I mean? It's just to know that stuff, because you can't look that stuff up.
When trials get to a certain stage, then they're made public because people are recruiting. Whereas in the background, I'm in the lab down in UCC, and I have my cell lines, and I'm researching a type of new treatment for them, and I'm working away in it in the lab. And you know, I'll have the radio on in the background, and I'll have my supervisors there coming in. And again, it's easy to feel like I'm in a lab and I'm doing this here, but really I'm doing it for the entire community. I'm doing it for everyone. Yeah. So supporting Breakthrough, I'm doing it for everyone who's in Ireland, who we're all indirectly or directly connected to someone who has cancer.
Yeah.
So it needs to be, the awareness needs to be bridged from both sides, because the projects are exciting, and they're always approaching the line where they're ready to proceed to the next level. And you just have to get all of the information you can at the safest and best way you can to that line, so that the project can be carried over. And that's the importance of the community in research, that it always progresses.
Yeah, and it gives that hope then outside.
And I think that's important from the researcher side as well, that it's very easy, as Patricia says, to be working away on your day-to-day, what you need to do to have that connection back to, this is for patients and their families, and what the ultimate aim of it is. It's not just an academic exercise. There's a purpose to it, and a very clear aim and intent, and to be sort of constantly reminded of that, and that it is always about a patient and patient's family, and trying to improve the outlook for those people and their families.
So my project actually looks at, so every cell will have an effect put on it by a drug or a chemical of something. And that chemical or drug will act on a receptor in a cell, because it receives it, kind of like a key into a lock. And once that key turns in that lock, it causes an effect of some sort. And what I'm looking at is the growth effects, because we want to control the growth of the cancer. So my project looks at retinoids, which act on a retinoic acid pathway. And this had been investigated before in the 90s, where they applied retinoic acid to the cancers because it can control the growth of the cells. But depending on which key and which lock they turn, you can activate increased growth or reduce growth. And in the time that has passed since, they have discovered that there's actually not just one master key that turns and activates an unknown result of increased growth or decrease of growth. You can find a specific key, a specific retinoid, that will turn in a specific receptor or lock to what we're hoping to do is selectively turn down that growth. So only, we'll say, finding the keys that open the doors that cause reduced growth. So it's more targeted and you're more certain of the results that are coming out of it. So the cell lines I'm working with, I have a whole host of different retinoids and that's what we're doing. We're trying to find the ones that actively turn down the growth to bring it under control so that the cancer isn't as aggressive and is more amenable to better treatment. So it's exciting to see it happening in the lab. And you know, when we come up with an idea and we think, okay, well this might work and this might actually result in reduced growth, we'll try it. And then when you see it actually happening, you think, oh my gosh, this
amazing.
If I get enough good data on this and bring it and pass it on to the next, like a relay race, I pass it on to the next stage and think, what it could do for people someday with the support
and to start a new little lab with yourselves.
Yeah. with the support of my supervisors, with Andre and Collette, with UCC, with Breakthrough, but with the acknowledgement of, I suppose, and the awareness raised by everybody, because it's again, thank you for coming today and talking to us about it, because the awareness has to be raised so that we can actually do this research that can benefit people with glioblastoma and really bring it to that next step, because it's exciting to see it happen and it's exciting to think of what could happen with it in future once it gets to that stage. So it's really important. There's so many boxes to be ticked along the way for really good reasons. But it's very exciting, and it's a privilege to be studying on a day-to-day basis because of how important it is and how badly it's needed.
Yeah, and it's do you know what, it's a privilege to have you studied and putting out all these studies, because it's the likes of my family and people that are all affected. Do you know what I mean? And you have all loads of other families coming, and you know they're coming through behind you, what you're going through, and to see work going on it is great. Do you know, because it isn't one of the better known cancers. So it's great to see that the work is going in the background and that you're not left on your own.
No.
You know, where you feel sometimes that you're on your own, but it's great to see that there is actual research going into it here in Ireland, and that it's Breakthrough Cancer are working well with you, and it's such a help for us. Do you know what I mean? It gives you hope.
And there are lots of good cancer stories, you know, as we know, like research in other types of cancers have resulted in really positive results. You know, breast cancer isn't the diagnosis that it was 15 or 20 years ago, and that's all because of research, and it's all because of trying to understand not just that someone has breast cancer, but what is it about their cells that's different, that's causing them to grow in that way. And instead of just using very kind of generic treatments that would kind of get most people, identifying for this woman, this is the right drug because it will address exactly what's happening in her cancer. And that's why the results from those kind of cancers are much more positive now than they were before. And it is quite a sort of personalised almost. It's saying it's not just that you have glioblastoma. What is it about your cells that are behaving in the way that they are, and how can we shut that down or silence it or control it in some way to reduce those cells from growing? So I think we have to be very hopeful from the evidence that research plays a huge role in changing how we treat and manage cancers, and we'd certainly be hopeful that what we're doing, the aim is to bring that for this type of cancer. So there have been huge advances, and so we'd be quite hopeful that research is definitely the way to get to that end point.
You have that fear that you're going to pass this on to your children. So, do you know what I mean? I'm like going, can this be passed on? And you're just like going, the research has been done. They're going to get on top of all of this. Do you know what I mean? But it's always a fear that there's something in your genes that gave you this and that you could pass it down along the line, like.
Yes, and for this kind of brain tumours. There really isn't any sort of genetic thing. So that's not something you should be overly worried about, I think.
Yeah. I suppose that's more research then into what are the risk factors. As Collette said, there's no real risk factor that can be written down now other than previous exposure to radiation. But we need to know where and why and when and how. So there's so much room for research with glioblastoma. There's so much scope, and I suppose what we're researching in the lab is how can we effectively treat it, and there's more research needed on, I suppose, identifying those risk factors and identifying the early interventions, and there's so much scope for research, and it's badly needed.
Yeah. And if I can go back to the point you made earlier about your symptoms not having those ones that we're all, I suppose, that we would connect with a brain tumour, that having headaches or seizures, I think you're raising awareness for people as to what signs there might be. And even if you didn't, or it wasn't immediately identified as being a brain tumour, because we know that the earlier any kind of cancers are identified, generally that'll lead to a better outcome. So people being aware of what kind of changes or symptoms that they might have for different types of cancers, to be aware and I suppose feel confident enough to go to their GP or their healthcare provider and say, I don't feel right.
I just feel tired. I don't know what's wrong with this. Something.
And I think everybody knows themselves best, and if you don't, to try and get the answers as early as possible is always it helps for a better outcome. But raising awareness, I think, is one of the really important jobs that we all have to do.
Absolutely. Yeah, thank you, Niamh, because it's something huge to come on and to share the story of why you started to not feel right, and why people should talk to their GPs, and what to be aware of. I suppose awareness for research, but awareness for symptoms, and bringing those two together so that less people are affected with glioblastoma or are told that there's limited treatment, and nobody wants to hear that. And there's so many groups of people need to come together to reduce that happening, because it's possible with research, but the research needs to happen.
Yeah. Thank you very much. Thank you, Niamh.
Thanks, Niamh.